Let's look at low back pain and how we are going to treat it today. 60-year-old lady obese with hypothyroidism, and hypothyroidism and obesity is a high risk for general anesthesia. We decided to do a minimal access transforaminal approach. Our medications, exercises, weight loss, strengthening your spine with physiotherapy. We use a fluoroscopy or a live x-ray to locate the position of the disc. This is a process which can be done without general anesthesia. Now, this is a percutaneous disc biological repair. Let's look at low back pain and how we are going to treat it today. Today we have a 60-year-old lady obese with hypothyroidism. Hypothyroidism is when your thyroid gland does not produce enough thyroxine, and what happens is you start to gain weight, you become more lethargic, your muscles also become really weak. So we had a patient like that, and hypothyroidism and obesity is a high risk for general anesthesia. She had severe low back pain for the last few months, but over the last 3 weeks it had increased much more, and I had also treated her with anti-inflammatory and a lot of drugs to reduce the nerve pain, but it didn't help. And as spinal surgery under general anesthesia was quite risky, she asked for an option, an alternative which was safer. And after talking to her family, we decided to do a minimal access transforaminal approach, percutaneous disc repair for her. Yes, the name sounds very confusing, but when I explain what it is, it will be really interesting and exciting. So what is this process? So now I will be taking you down to a model where I will show you how a disc bulge occurs. So if you see this is a normal disc. If you watch, the rubbery material is within the bone. Now let's move to the other disc. If you see, the inner gel material now is slightly starting to come out. This is how a disc bulge starts. Now at this stage you can exercise and you can sort it out. But moving to the next one, if you watch here, the disc material is entirely on the outside, and that could cause a compression in the spinal cord, which causes the pain. And now in the procedure, I will be injecting and entering into this region, and I will be extracting out this disc material and also repairing it. And that is the procedure you will be seeing today. Generally, when you have a disc bulge, the treatment options which you have are medications, exercises, weight loss, strengthening your spine with physiotherapy, and a lot of other physiotherapeutic modalities like IFT or laser, to name a few. If it is not improving with that, then your option is conventional disc surgery. Now this percutaneous disc repair is a process where we enter the disc through the skin using a hybrid approach. That is, we use a fluoroscopy or a live x-ray to locate the position of the disc. So that shows me the bones, and then I also use a hybrid ultrasound and place the probe right on the disc in order to see the soft tissue. And using the ultrasound probe and the fluoroscopy, I can enter into a space known as the transforaminal space. It is a small triangular space called the Cambin's triangle. And once I enter that space, I have access into the disc. So I can remove the disc material outside and also inject or deliver healing cells or stem cells into the disc and around the disc and in the regions where there is inflammation, and that helps in reducing the pain and changing the disease process caused by the disc bulge. Now, as this does not involve any skin opening with a knife, it is called as a percutaneous disc surgery. And as we deliver healing cells into the region of the disc bulge, it is also known as a biological disc repair. Now, this is a process which can be done without general anesthesia, and that also is a great advantage. My patients always are talking to me throughout the procedure because it is extremely important for me to identify if my needle is going anywhere close to to the nerve root, because if it does, the patient, when they are awake, they will have a sensation of tingling down the legs, and that really helps from avoiding any complications related to a nerve injury. Now, this is a percutaneous disc biological repair.